Hi guys, my name is Jamie and I am presenting my educated citizen portfolio related to childhood obesity in Nebraska. I chose this issue because it is one that is prevalent in the state of Nebraska um, by the National Initiative for Child's Healthcare Quality, publication date unknown, and one that I will likely come into direct contact with as a healthcare professional working in family practice settings, and I felt that it was an important topic to research and address. My personal connection to this issue is that I want to work in a family practice clinic after graduation. I know that working in a family practice, there will be children coming in that are underweight, overweight, and even obese. My first effective communicator experience related to childhood obesity happened in Nursing 340, community based care across the lifespan. During my clinical rotation at Nebraska Methodist College, I was given the opportunity to work with a nurse and assist her with giving medication to a child. Um, but before I could get the medication to the child, I had to go into the system, into the computer system, and to verify that we had an accurate height and weight on the child before giving that medication. From what I learned from that experience, you always want to make sure you have an accurate height and weight when it comes to a child before giving medication because medication dosage is based off of height and weight. And it's very important to educate parents that they should know their child's height and weight. So that way, if they have to give medications, um, like over the counter, that they have that. So that way, their child's given the appropriate dosage when it comes to medicine. How can I use what I learned from that experience? Caring for children who are obese and educating parents why it's important to have accurate weight because it is used to calculate the appropriate medication dose. My second effective communicator experience related to childhood obesity happened again in Nursing 340, community based care across the lifespan during my clinical rotation. I had to get a weight on a child. When I got that weight on the child, they were considered overweight. So I had to discuss with the parents about body mass index, which is BMI, and that is commonly used to determine childhood weight by dividing a person's weight in kilograms by the square of height in meters. And that was by the CDC of 2021. How can I use that for the future? Apply it in clinical situations where I can care for children who are not in the healthy weight status category and discuss healthy options and activities with the parents to help get their child in the what is considered the healthy status range. My reflective individual experience related to childhood obesity, my junior year at Methodist College, during clinical, we got to go to schools to do vision screenings during Nursing 340 to with low income, underprivileged area of the Omaha area. And during that experience, I worked with students between the ages of preschool and fifth grade who came from a variety of cultures, ethnicities, socioeconomic backgrounds. And it was while interacting with those students and watching them interact with their teachers and each other that I was a way to practice being a reflective individual. What I learned from that experience is analyze perspectives of holism more critically, and such as not having preconceived notions or judgments of uh, how I expected certain individuals in each situation to act. Rather, I learned that I must keep an open mind and an open heart and meet an individual right where they are at and get to know the whole person or group of people and not let my view or opinion of them be clouded by negative preconceptions. I also learned that treating every person with respect and non-judgmental attitude will not only help me be a better professional healthcare professional, but a better individual as well. What I've learned from that experience is seeing and treating individuals in a holistic way and apply it when caring for patients and families who are dealing with childhood obesity. When I'm seeing my patients dealing with the effects of childhood obesity in a holistic way, will allow me to focus on treating and caring for them without letting biased or invalid preconceptions about who they are, where they live, or why the child is obese to interfere with my ability to build a trusting, caring relationship with my patient and their family. My second experience for a reflective individual happened during Nursing 340. I withdrew from the class twice and took it for the third time and failed. I've gone through some trials and tribulations myself. I had a great support system with friends I made while in school, but I did not have a great support system at home. While I have reflected on this change, I can say that I'm proud of myself to how far I have come. I've been able to focus on my education, and I am looking forward to possibly continue my education after graduation. What I have learned is I can take this experience and be a role model for children who are overweight that are going through some trials and tribulations themselves. It is always important to be a part of someone else's support system because you don't know for sure what's going on in someone's life unless they tell you otherwise. I can encourage them to do physical activities, eat smaller, healthy meals, snacks and drinks, less screen time, and more sleep time when it comes to a child being overweight, and just educating patients and families, those that are involved in the child's life. It's very important to have that support system be all on the same page. My change agent experience related to childhood obesity happened my junior year. I had the opportunity to become a supplemental instructor or SI leader for pharmacology. It was part of my duties to assist other students that were taking pharmacology class and help them understand the pharmacological principles and complete analysis of pharmacokinetics and drug interactions. What I've learned, I started to develop cultural competencies in the sense that I began to demonstrate respect more fully for the views and opinions of others. There were many times throughout the course of being a SI leader that I had to show respect for another individual's point of view. Also, through this experience, I was able to work on becoming a change agent in the sense that I was constantly working to draw the individuals in and to promote participation. How can I use what I've learned? Culturally competent change agent when working with parents and their children with childhood obesity by realizing that individuals from different cultures may have different cultural norms than I am used to. As a healthcare professional, respect for the different opinions and viewpoints of individuals from different cultures when educating my patients about the cause and effects of childhood obesity. Showing respect for different cultural opinions will help me build a rapport with patients and facilitate good communication between me and my patient when I educate about childhood obesity. My second change agent experience related to childhood obesity, I noticed at my job that history of present illness on a patient was not current. I asked the patient the questions that did not get asked or got missed when they were screened on the phone. I know how important it is to have current information on a patient, especially when it comes to children and having accurate weight and height on them. Lately, information has been getting entered wrong at work and the information is not correct good majority of the time at work. The office manager um, was informed about the situation, and that the office manager sent out an email to all of us at my job to make sure that we are accurately taking the time to put in information correctly when it comes to patients, not just patients as adults, but patients as children, because that affects medications when they come in and see the provider. What I learned is make sure all employees that are screening patients before or during the visit and need to make sure they are gaining all the history of the patient illness for the visit. And it's very important in my job because I work at a clinic and we are prescribing medications to adults, to children. But I notice the one thing when it comes to children, the providers are asking, what is their current weight? What's their current height? And they are literally taking that information and making sure that they are calculating and giving medication appropriately to the child, and letting the parents know this is how much you should be giving them for each dose for this medication. In conclusion, my presentation, how I've grown to become an educated citizen during my time at Nebraska Methodist College by becoming an accomplished, reflective individual, effective communicator, and a change agent. This presentation has recapped a few of the experience that I have contributed to my growth in these areas, and has also discussed how I will use what I've learned and apply it to public health issue of of childhood obesity in order to ensure that I am doing my part to effective positive change in the lives of every single person I come into contact with, both as a healthcare professional and as an individual. And here are my references. And I want to thank you guys for listening. And that's it. Thanks.